This video is a supplement to our sedation course. It focuses on the emergency cart and how to use it. Our objectives are to discuss the three parts of our emergency kit, which we call Rolling Thunder, give an overview of the contents of the emergency drugs, and an overview of the contents of the cart itself. Of course, this is part of a larger course. If you're an AGD resident the whole year, if you're studying with us for the sedation course, this is a supplement to that. If you'd like to study with us, we run this course every July for the residents, and you can find more information at mccrackenimplanteducation.com. Okay, Rolling Thunder is a kit, cart, device, emergency system that Guy Rosenstiel has brought to us. He based it off a system that he learned in Georgia with Dr. Pruitt. Here's the emergency drugs on top, the cart itself, which is a mobile cart that we bought from Lowe's, and then the emergency oxygen in the ambu bag, which is just nice. If not every emergency, of course, happens in the operatory where you have plumbed oxygen. It can be in the waiting room, in the hallway. We've had them out in the grass next to the clinic, so you just never know. It's nice to have it all together. So let's look at the emergency kit, or the drug kit itself. As you get into the kit, you'll see that it's organized with the ACLS drugs front and center on the top. There's 3 rows and the bottom of the chest here. You can easily access these while you're working in the clinic. We have on the top row, behind the ACLS drugs, we have several things that are useful that you will find yourself using on a yearly basis, at least, if not more often. We have beta blockers, esmolol and labetalol. We have glycopyrrolate and atropine for bradycardia or to dry up secretions. Zofran here, promethazine or Phenergan on the top row here next to diphenhydramine. Some of these have the doses or the uses printed on the side. In an emergency, all the information you can have available handy is a good idea. So your Benadryl, Toradol, which is an NSAID for pain, obviously, nitroglycerin, ammonia tablets, which we seldom use. Let's go to the second drawer. Succinylcholine is really just a placeholder here. We keep that in the refrigerator. We have the Zofran we mentioned. We have phenylephrine, which is a vasopressor. Ephedrine we have also, but it's located in the safe because it's a Schedule III drug. We can't keep it out on the clinic floor. Here you have the epinephrine. This is the 1 milligram per ml concentration. And for intra-arterial injection, we have some lidocaine or some procaine available. On the third row, perhaps the most important for your daily use, you have your reversal agents, your benzodiazepine reversal, flumazenil, your naloxone. We have thrombin in the refrigerator, glucagon for hypoglycemic issues. In the bottom of the drawer, it's a little bit hard to see, but you have your albuterol inhaler, some more Benadryl, dextrose for hypoglycemia, and epinephrine in your cardiac ACLS concentration, which is 1 milligram per 10 ml. This piece of paper is our little cheat sheet. It has a variety of emergencies listed and the drug dosage that you might want to use. All right, let's turn to the body of the cabinet, or the place where all of the emergency devices are located. I think of this in sort of airway, right? If real estate is location, 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 cart's about maintaining the airway. And then we have B for blood access and some items there to get an IV started. So let's look into the first drawer of the emergency cart. In the top drawer, you have some basic items, basic airway, things like your oropharyngeal airway, your nasal trumpets, and your masks for an ambu bag. If you need to get a blood pressure, occasionally the machine will malfunction or the automatic blood pressure won't read because it's too low. Seen that before. KY jelly to advance some of these things. A key for the oxygen tank, extra valve, and a bag in case someone's hyperventilating. In the next drawer down, we have an advanced airway. Guy keeps these laryngeal masks in there as a contrast. Really, these are a little bit harder to use. These are the eye gels. Grab the green one. Green is go. Number 4, middle size, fits most patients. And probably most of us, somebody like me who doesn't intubate patients, could get an Airway using this advanced technique, a laryngeal mask, if you needed one, more so than if you had to intubate a patient, for example. In the next drawer down, we have items primarily for venous access. Imagine you're in the waiting room. You need to get a line on somebody. Here's a catheter. Here is the IV setup and saline. We have some pads in a plastic bag for your monitor and other things that you might want to do, a cannula to set up some oxygen. In the bottom drawer, you have a couple items of last resort, a quick trach for a tracheotomy, and also, as required by law in most states, some intubation equipment. If you had an anesthesiologist around or you're familiar, comfortable intubating patients, this is where you would go. On the side, of course, is the oxygen. We keep one full, ready to go with valve on it, and one in reserve. And you can see that this has the plastic tab on it, so I know that one's full. So we have hopefully 2 full oxygen tanks for any emergency. Our vendors, we get a lot of this stuff from Southern Anesthesia, from ACE, and Guy Likes Medical Purchasing Solutions. Thank you so much. That's the overview of the kit. We will get more into detail about how to use these different devices and what emergencies require each item.